Okay, so I'm going to show you how to use your brand new Ultima 20 TENS unit today. TENS stands for Transcutaneous Electrical Nerve Stimulation. TENS produces a gentle stimulation that blocks pain signals. Electrodes are placed over the area we want to treat, or the location where your pain is. You'll turn up the intensity of the TENS until your pain is reduced or blocked. It's kind of like turning up the volume on your radio to drown out the sound of noisy neighbors. Additionally, the Ultima 20 increases endorphin levels in the body. This is the body's natural pain-fighting mechanism. Consistent use of the TENS for 2 to 3 times per day for 1 to 2 months will cause an increase in endorphin levels throughout the day that is persistent. TENS is non-pharmacologic, non-narcotic. Use as much as you like for as long as you like, but use at least 2 to 3 times a day. And that's so that you get that increased level of endorphins in your system even when you're not using the TENS. Depending on the settings you select, this will be from 25 to 40 minutes in length and is pre-programmed into the TENS and is viewable at the bottom center of the LCD screen, and we'll take a look at that in just a minute. Okay, so setup of your Ultima 20 is easy. Comes in this nice carrying case. When you unzip it, you'll find your TENS unit, a set of 4 electrodes, the instruction manual, a couple of AA batteries, and a set of lead wires. So to set it up, first we want to plug the lead wires directly into the TENS, and they plug directly into the top. And then we want to plug in our electrodes. And we have 2 sets. Each lead wire has 2 pigtails at the end, a negative and a positive, black and a red, and it does not make a difference which one goes where. Let me take the other set. Okay, now let's take a closer look at the TENS and how to set it up. Okay, so now let's turn our TENS on. Open up the lower door and depress the on-off key. You'll notice when you first put your batteries in, and the batteries, by the way, we haven't discussed this, are placed in a back battery compartment. So when we first turn the unit on, it's going to start out in manual mode, and we're going to have to move that into preset mode in order to use these charts that we talked about. So we'll press and hold the mode button until manual changes over to preset. And there we go. Now it's in preset mode. For our example today, we're going to use P10, which is our low back pain setting. So let's go ahead and enter that program setting P10 into our TENS. It now says P8. In order to get that to P10, we simply depress the mode button once and twice. And now for low back pain, you'll see a little dot on the low back. If we happen to miss our setting and accidentally go too far, not to worry. It will cycle through to P19 and back to P8 again. And there we are at P10. So now that we've got the appropriate program setting, let's go ahead and place the electrodes on the body according to what we see in the electrode placement chart. So the placement chart shows us 4 electrodes on the lower part of the back. The goal and what we're trying to do is we're trying to cover the area of pain. For some people, it may be a little bit lower. For others, it may be a little bit higher. You'll notice each electrode is labeled with 1B, 2B, 2R, and 1R. What that's talking about is 1B and 1R is channel 1 black and channel 1 red. 2B and 2R is channel 2 black and channel 2 red. You'll see in the diagram down below, channel 1 is your left intensity knob, which is right here, and channel 2 is your right intensity knob, which is here. So when you look at your electrodes and the lead wires, you'll see this is your red electrode and this is your black electrode. And you will want to go ahead and place those electrodes according to the diagram here. Once that's done, you go to you're done with the lower door here. You go ahead and you turn the intensity up. So as we increase the intensity, we turn these knobs clockwise, and as we turn the knob, we'll see the intensity increases down here numerically, and we can see it's at a 4 now. This number runs from 0 to 20. Most people typically operate the unit between 3 and 11 on their first use. Once you find a level that's comfortable on the right side, go ahead and do the same on the left side. And I'm calling these left and right, but it's really channel 1 here on this side and channel 2 on the right side. And you simply turn that up until you're comfortable. So when we open up the lower door, there are a number of buttons here, most of which we don't need to use. There's the on-off key, which of course turns the unit on and off. The mode key, which will move the unit from the manual mode to the preset mode. In addition, short presses of that key will also switch the program from P8, 9, 10, 11, and 12, and so on. Additionally, you're going to see these other sets of keys here. The PW key stands for pulse width. The PR key stands for pulse rate. Because we've moved this unit into preset mode, they do not operate. They don't do anything. If you want to get involved with the manual settings and you want to use those, you can find complete instructions on that in the instruction manual. The wave button, additionally, is also preset, so depressing that will have no effect. The timer button will adjust the sleep timer, which is currently at 30 minutes. You press the button, it will drop to 20, then 10, and then back to 30 again. The lock key does work, and it locks the buttons on the lower panel here, most of which don't work in preset mode anyway. But if we push and hold that lock button for 5 seconds, the key shows up. That tells us our unit is now locked, and in this case, even the mode button is locked. You depress again for 5 seconds until that key goes away, and then the mode button and the other keys are operational again. So just a couple of other important points about the TENS unit and the electrodes. So patients are required to schedule a follow-up appointment with their physician for assessment after using the TENS for 30 days. This is a requirement for purchase of the TENS unit. Please be sure to set this up as soon as possible and call our office and let us know the date and time of the appointment. We're going to need to get a copy of those notes. The appointment can be no sooner than 30 days and no more than 60 days after you receive the TENS unit. This appointment is short and consists of just a few questions to determine if the TENS is effective for you or not. If the TENS is working, then we'll send you a 3-month supply of electrodes by mail. This includes 6 sets of electrodes. Each should be used for 2 weeks before disposing of them. When you need additional electrodes, just give our office a call or send us an email and we'll send them out to you right away. On the other hand, if it's determined that the TENS is not working for you, you'll bring it back to your doctor office and leave it with them.